Hello, Dr. Marc and Dr. Colleen VanHoogstraat from Lifetime Wellness for our Wednesday
7:05.
live at 7:05-ish again. First things, if you're local, you know that we've had some storms roll through here this afternoon, so we have very sketchy,
Lots of rain.
very sketchy service right now. So hopefully we can pull this video off tonight, but if not, don't worry, we will redo it. A couple things before Dr. Marc dives into tonight's topic. We do finally have all these live videos posted over on our YouTube page, which is youtube.com/lifetimewellness. When you're there, make sure you subscribe to that channel, even click the little bell so you get a notification when we post a new video, a new lesson there, so you don't miss those. And same thing here on Facebook. You can subscribe for notifications when we post new things here. But I know a lot of you have been asking for these videos to be posted elsewhere so you can share with people who are not on Facebook. So they're on YouTube right now, and they will be on our website soon as well. One other thing before we dive into tonight's topic, which, by the way, is
Getting controversial tonight.
cholesterol and statins. And I know some people have asked, like, okay, you're chiropractors, why are you talking about that? Don't forget, we have this whole other side of our practice and our profession that is all functional medicine based, functional nutrition, so obviously cholesterol and statins fit right in there. But you're going to learn something tonight about how this topic also fits perfectly with what a lot of people stereotypically think of when they think of chiropractic. You're going to be surprised what you learn about this. Before Dr. Marc gets started though, I want those of you who are watching live or those of you who are watching after the fact to comment. I want you to answer this question. Have you been told that your cholesterol is high? So answer the question in the comments now or when you watch this video back later. All right, and with that, I think I'm handing over the band to Dr. Marc here. I'm going to be watching for questions during the live, and let me know.
Okay, so we're going to talk a lot about statins tonight, which are the most commonly prescribed cholesterol-lowering medications, and basically how they work, some of the side effects, and some of the inherent dangers that go along with this, because they are the most profitable drugs on the market. Pharmaceuticals love them; they make billions and billions. But we're also going to talk about cholesterol because that's the job of the statin, is to lower cholesterol, and maybe why that's not the best idea or the best approach. But when it comes to statin use, it's become more common in our practice that when we're doing just a basic history with a patient, they come in for a chiropractic visit, and they have complaints of aches and pains, and maybe some nerve pain, some muscle pain, maybe some weakness. In their history, many people now are taking a statin because they've been told their cholesterol is too high and they're at risk for heart attack or stroke. And so it comes up a lot because what you're going to hear tonight is a lot of the side effects, more of the serious side effects, very common side effects of statins are things that we see on the chiropractic side of our practice. Muscle aches and pains, back aches, nerve pain, numbness and tingling, weakness. Lots of things that can be attributed to just general musculoskeletal problems that people have. The side effects get much worse beyond that. So we see a lot of people suffering side effects of statins that come in for chiropractic care. Unfortunately, the chiropractic care is not going to fix that if the statin is causing it. So it's become a routine question in our history, and so then we just educate people from there on that, and they can go from there with their prescribing doctor. But I want to back up a second and just talk about cholesterol. And I've got some science here tonight. I'm gonna give you some statistics. I'm gonna try to keep it not too heady, but there's a lot of research, a lot of science on this, and it's pretty shocking. So first of all, let's talk about cholesterol and why cholesterol is not the bad guy. So cholesterol has really been demonized, and it's like this one little variable picked out of blood work that just gets treated when people who have high cholesterol, what would be considered high cholesterol, most of the time are completely symptom-free. So it's not something that they went in for and complained of, and they said, oh, let's check your cholesterol. It's just a random thing that's picked or noticed on a lab and then now must be treated, even though it's not causing any problems. So it's unique in that fashion. But one thing to know about cholesterol, especially what you see on a lab report, when you get blood work done and you see the total cholesterol number, all of that cholesterol is actually made by your liver. Very little to none is actually dietary cholesterol. That never makes it into your bloodstream. So your liver makes all that cholesterol. And a lot of your cells can make cholesterol as well. But cholesterol is used in so many areas of the body. Like cholesterol is one of the most marvelous molecules in our body. It does so many things, and it's responsible for, every cell in your body. Part of its cell wall is cholesterol, and it's the cholesterol that actually allows the inside of your cell to be different than the outside of your cell. It makes it like waterproof. So every cell structure in your body is made up of cholesterol. It's used as nature's repair substance, so it's critical in wound repair. So any kind of tissue, if there's damage, cholesterol is going to be called to repair the wound. So many hormones in your body are made from cholesterol. So things that regulate mineral metabolism, blood sugar metabolism, hormones that help us deal with stress. So all the adrenal hormones are made of cholesterol. All your sex hormones, testosterone, estrogen, progesterone, they're all made of cholesterol. Cholesterol is a precursor to vitamin D. Can't make vitamin D without it. Protects us from depression. It's critical in utilizing serotonin, what's considered like the joy hormone. Bile salts needed to metabolize fats made from cholesterol. So it's a powerful antioxidant. It's even been recognized as fighting infections. So it's critically important in our body. And so prescribing a drug to reduce the amount of cholesterol your body can make has some detrimental impacts and very little benefit. And the science is clear on this, and I'm going to explain some of the numbers because what you hear on the commercials is not reality.
What?
Yeah, really. Don't be shocked. But so I want you to understand, first of all, that cholesterol is amazing, and in fact, what might surprise you or shock you is statistically, people with lower cholesterol die more often, especially of cardiovascular risks and strokes, than people with high cholesterol. In fact, a middle-aged male with cholesterol over 300 has just a tiny, it's just, what's the word I'm looking for here? Slightly more at risk for a heart attack than someone with lower cholesterol. And if you're a middle-aged male with cholesterol under 300, there's no greater risk for a heart attack. But again, with cholesterol being very important in the body, when you have lower cholesterol, that's when you're really at risk for damage and poor health. And I'm going to show you a chart that reflects that. So we talk about statins. There's common names are like Lipitor, Crestor, Simvastatin. There's another one I forget, it starts with an M. And top money maker for pharmaceuticals. Lipitor alone, at one point in its heyday, was making $25 billion a year, one drug. It's estimated worldwide that next year, 2020, all statin drugs combined are going to tip $1 trillion in revenue. So this is their golden goose. This is why talking negative about statins is not going to go anywhere. We're not going to hear it on mainstream media because it is the moneymaker. But one of the side effects, or one of the implications of taking a statin and how they work. So a statin will lower your cholesterol. A statin inhibits an enzyme in your liver from being able to produce more cholesterol. Okay, so it will do that, but that doesn't equate to better health or improved function or a longer life. There's no association there. So how the statin works, it inhibits an enzyme to make cholesterol, but at the same time, it prevents your body from producing CoQ10, which is another very protective nutrient in the body, especially for the heart muscle, all muscles in the body. There's some evidence to show that this lack of CoQ10 is why a lot of people start to suffer the muscle aches and myalgia symptoms from a statin. It's not conclusive yet, but regardless, lowering your CoQ10 levels is not a good thing at all. And in fact, the studies have shown that you can see a dramatic drop in people's CoQ10 levels just with weeks on a statin, not to mention years on a statin. And I just want to explain the importance of CoQ10. So when CoQ10 is depleted, first of all, it just causes your LDL cholesterol to become oxidized, meaning it becomes rancid, it creates massive inflammation. And inflammation is really the hallmark sign or cause of heart attacks and strokes. It's not the cholesterol per se. But here's some of the things that can happen with just a CoQ10 deficiency, which is virtually guaranteed when you're on a statin. So a CoQ10 deficiency can cause fatal cardiomyopathy, heart attack, congestive heart failure, which usually carries a death sentence of 5 years, exhaustion, cancer, myopathy, depression, which is resistant to antidepressants, high blood pressure, gum disease, tooth loss, hair loss, liver disease, sudden complete memory loss or amnesia, cataracts, angina, cancer, did I say that already? Folic acid deficiency, damaged cell membranes, and more. So I think many people have seen the commercials where there's a dude dressed like a pharmacist and he was, told he was prescribed a statin, so he knew he should be taking a CoQ10, and then he recommends a popular brand of CoQ10. And that's well established in the literature. So another really common thing that we hear from our patients is we see, on their intake form that they're on a statin, and so I ask every single one, so when you were prescribed a statin, were you also prescribed a CoQ10 supplement? Because it's an automatic side effect of taking a statin is you will lose your CoQ10, and you need to replenish that if you're on a statin. And 90% of the time, the answer is no. They were never even told about CoQ10. In my eyes, that's just complete malpractice. That's completely avoiding the science and the literature, and that person is going to suffer as a result of it. Something that, if you were to take a statin, taking CoQ10 is mandatory. You have to. Studies show like 200 milligrams a day would be optimal. So number one, if you're don't want to give up a statin, but if you're not taking CoQ10, get on it immediately. You will save yourself from a lot of damage. So let's flip over to now talking a little bit about the statins themselves. And there's a lot of research online that you can find. There's a medical doctor here locally in Birmingham, Dr. David Brownstein. Some of you may have heard of him, maybe gotten his books. His latest book is actually called The Statin Disaster. I would recommend getting that, especially if you've been told you need a statin or you've been on one for a little while. He's got a lot of write-ups on his blog. Great resource for this stuff. So there's a lot of, even people in the medical field that for a long time was saying, hey, whoa, these statins, not a good thing. And so they were started to be prescribed because they really just put their finger on cholesterol as the cause of increased risk of heart attack or stroke, when that's just not the case. And when they were invented this drug and they showed that they could lower the cholesterol, they started doing the studies looking at comparing people taking cholesterol to people on a placebo. And so in some of the commercials, like for Crestor or Lipitor, you might see in the small print or hear them talk about a 36% reduction in heart attack or stroke, or some kind of heart incident or event. Or I think that was Lipitor, and Crestor might have even been in the upper 40s. Well, this is something really important to understand, because this is pharmaceuticals' little sleight of hand that they use with the numbers, and they're not reporting the actual number that really lists how many people benefited. So I'm going to explain this to you. Just bear with me on this, because there's two things that are printed in the studies when they do drug studies. There's a relative risk reduction, and there's an actual risk reduction. So let me explain it. So say you have 1,000 people in a study. Half of them are taking the statin, half of them are taking a placebo. And so they're going to look at the number of cardiac events in both groups. And so say in the placebo group, you had 2 people suffered a cardiac event, a heart attack or a stroke. And in the statin group, 1 person did. So 1 into 2 is 50%. That's a 50% reduction. That's the relative risk reduction. That's what you hear reported on the commercials and in the news when they talk about, oh, this new amazing drug showed a 50% reduction in heart attacks, when the actual reduction rate was 1. one less person out of 1,000. So that's 0.1%. That's not even a full percentage point of improvement. So of the 1,000 people that took the drug, 999 got zero benefit. One person benefited out of 1,000. Terrible. Like, it's just totally insignificant. So the relative versus the actual is what really needs to be displayed or showed, because one sounds fantastic. When you actually look at the numbers, if only one person, and this is through all the studies, they always came down to a 1% or under 1% actual risk reduction in all the statin studies. So no matter what the relative risk showed, from 30% to 40% or 50%, it always came down to 1 or less percent. And when they even looked at extending your life by taking statins, you had to take if you took a statin for 5 years, they estimated you would live 4 days longer. So you got to put up with all the side effects and all the damage you're doing to your body to potentially live an extra 4 days for taking a drug for 5 years. So we really question the benefits of statins when we also understand all the side effects and all the negative things that come with it. So let me share some of that with you, because this is where it gets, where we say the pedal hits the metal, and you need to decide as a consumer, as your own health advocate, is this drug worth taking? What benefit am I going to get with understanding all the risks that are involved? So there was a study done in the Journal of Endocrine and Metabolic Diseases. This is back in July 2013. And this was done in Ireland. And if you want any of the citations or any of these studies, just message us and I can send you copies of all this stuff. So I'm just going to kind of summarize, but the authors performed a very comprehensive review of PubMed, Embase, and Cochrane Review databases for articles relating to cardiovascular primary prevention and statin side effects. And this is what they showed. And this is a comprehensive review of all the studies on statins. First line is, they do not work for the primary prevention of coronary heart disease. Primary prevention means they're giving it to someone who, considered generally healthy, has not had any cardiovascular event, no heart attack, no stroke, and a lot of times no history of it. So just based on purely on their cholesterol level. So primary prevention does not work for that. You will not reduce anybody's risk for heart attack. Next, they cause or increase your risk of myopathy. They cause and increase your risk of lung disease, diabetes, intracerebral hemorrhage, Parkinson's disease, cancer, cataract, and arterial calcification. And one of the key points from this article was they basically summarized it in a quote: there is a categorical lack of clinical evidence to support the use of statin therapy in primary prevention. So they're saying that no one should be given a statin to prevent a heart attack or stroke. For people who have already had a heart attack or stroke, the studies are there, and the benefit is also very, 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 very small. Now this one is really alarming. I got this one from Dr. Brownstein, and he writes about this in his book, The Statin Disaster. So a lot of people have heard about the disease ALS, amyotrophic lateral sclerosis. Most people know it as Lou Gehrig's disease. It is a terrible, rapidly progressing neurologic disease where the nerve cells in the muscles are attacked, and eventually the people start to lose function of all their limbs, to even swallow food, to breathe, and it's really just a devastating disease. No known cure for it. Just a terrible disease. And so not long ago, this was reported in a Canadian news article, and where they were quoted saying, physicians are uncovering surprising links between ALS and other diseases like Alzheimer's, Parkinson's, and frontotemporal dementia, which were thought to be unrelated. And what was the link between them? Statin drugs. So a 2018 article in Drug Safety, just last year, looked at the diagnosis of ALS for each statin drug that's being used in the market. So number one, that's got to be a red flag right there. They're actually doing a study in the FDA adverse event reporting system looking at ALS with respect to each statin drug that's prescribed. So something's going on there where they had to go looking for this already. And so the scientists found statin drugs were associated with a 9 to 107-fold increase in ALS diagnosis depending on the statin drug that was used, and they broke it down. So Crestor had a 9-fold increase, Lipitor a 17-fold increase, Zocor a 23-fold increase, and Mevacor a 107-fold increase. So, and let me show you how strong that association is. So this was not a randomized, double-blind, placebo-controlled study. It was an association link, but the association of statins with ALS is greater than the association of cigarettes causing lung cancer, because there's never been a randomized, double-blind, placebo-controlled of smoking cigarettes and lung cancer, but the association was so strong that the link is obvious. This association is even stronger than that. And trust me, you do not want ALS. It is a terrible, terrible disease. Okay, so if I haven't shocked you enough right there, you really need to question whether or not you need to be taking a statin, but because when it comes to cholesterol levels, I have this amazing chart, and don't freak out with all the graphs and the lines and everything. I'm just going to summarize this for you because it's super great. But I make copies of this for patients all the time. This is a study from the World Health Organization where they took data from 164 countries. This is a massive worldwide study, and it had one purpose. It looked at total cholesterol levels versus mortality data. So why people died. And so they looked at cholesterol levels and death due to all different kinds. So cancers, infections, respiratory diseases, diabetes, you name it. And the blue line is the summary. And so what they found was the cholesterol level associated with the lowest death was 200 to 240. So where this dips right here is 200 to 240. And look what happens to death rates as cholesterol levels drop under 180, 170, the death rates skyrocket. And this is true since mankind's been on the planet. Low cholesterol is worse for you than high cholesterol, and you will die sooner with low cholesterol than you will high. That's just statistically, that's just the fact. That's our physiology. But this study showed the normal range of the lowest death rates was 200 to 240. So I remember back when I was a kid, learning about this stuff, in grade school and health class. 250 was normal when I was a kid. I remember 250 was normal cholesterol. Then at some point they lowered it to 220 or 225. Then it was lowered to 200. Now they want it under 180. I had people bringing in blood work where they're on a statin and their blood levels, or their cholesterol levels down to 150, 130. Not good at all. So this here just shows you, and if anyone wants a copy, I can email it to you. So, one of the things that's talked about with statins, and another thing that kind of gets put to blame is, along with cholesterol, is, if your cholesterol's high, you need to cut out saturated fat and go on a low-fat diet and, stop eating eggs and butter and things like that. Well, two things that you don't find in a clogged artery are cholesterol and saturated fat. They're not there. And in fact, medicine has done a complete about-face on this. It was quietly released in the news, not really much hubbub about it. But I have two studies from 2017, one in April and one in, I think it was August, from two of the top journals on the planet. One is the British Medical Journal, and I'm just going to read you the one quote, because it just kind of summarizes the whole thing. It says, despite popular belief among doctors and the public, the conceptual model of dietary saturated fat clogging a pipe is just plain wrong. In a landmark systematic review and meta-analysis of observational studies showed no association between saturated fat consumption and all-cause mortality, all causes of death, coronary heart disease death, ischemic stroke, and type 2 diabetes. No association at all with high saturated fat and any death. What another study from The Lancet later that year compared high fat diets, including high saturated fat diets, and high carb diets. And what they found was, again, total inverse relationship. The high fat diet, no risk for stroke. hardly any cardiovascular events. It was the high carb diet that people were dying early and dying of heart attacks and stroke and things like that, because they tend to cause more inflammation in the body. And it's inflammation, not cholesterol, not saturated fat, that will lead to damaged arteries and lead to plaquing in your arteries and things like that. So I just wanted to clarify a couple things, because those are all kind of related. If someone's put on a statin, they're also usually told to get on a low-fat diet. Just worst advice you could get. So if you're one of those people that have been told that, or you're maybe curious, because you get blood work every year and you're not sure where your cholesterol level should be, or you've been prescribed a statin, maybe you're experiencing symptoms. The studies show 1 in 3 people on a statin have the muscular aches and pains and sometimes even nerve pain associated with the side effects. 1 in 3, and the more severe side effects, I couldn't imagine trying to deal with those. So if maybe you want to get a different perspective on things you can do in your life to improve your health, and we're not licensed to prescribe or tell people to get off their medications, but we coach you on maybe how to have that conversation with your prescribing doctor, but also you're the boss of you, so you can do what you want. Fortunately, statins are those type of medications that unlike a psychotropic, there's no withdrawal effects, so those can be handled pretty quickly. But understanding the benefit versus risk ratio is huge, and that's probably wasn't explained to you. Most people never heard the thing about CoQ10. So if you want to talk to a holistic practitioner, someone who's focused more on your health rather than treating a lab number, give us a call, contact us, email or phone. We'd be happy to have a chat, and if you've had any blood work done, we can take a look at that. We can order blood work for you as well. But this is a really important topic because we see it every day in our practice, and people have just been misled on this, and there's just too many people going down this dangerous path with all these nasty side effects with very little to no benefit. So, that was a lot. But I think I was in that lane, all right?
That's awesome.
So,
I just want to reiterate, I'll talk a little more slowly than Dr. Marc. Just want to reiterate, we know, like Angela, I know you've already made some comments that you're not dealing with this, but family members are. I think that's true of a lot of people that we all know. Maybe it's not you, but we all know someone who's dealing with this. And if people really understood that cholesterol, first and foremost, isn't the bad guy, and the numbers have changed over the years, so something's not quite right there. Nonetheless, we need to focus on rebuilding and then maintaining high levels of health, regardless of what those numbers are. That's where we come in. It's just a different approach. We're always looking upstream for where our health may have gone off track and helping people get back on track. So please share. We all know people who need this information, whether it's cholesterol, blood pressure, something else along those lines. There's got to be a different approach and a better approach, and we feel that we've got that here. So I'll put our contact information in the comments. Let us know how we can help you.
see you next week.